So why do social determinants of health matter during pregnancy? While there is little doubt that genetics and lifestyle play an important role in shaping the overall health of individuals, research has shown that conditions in the environment in which people are born, live, work, and play are as equally important in shaping health outcomes. As previously described by Shannon, social determinants of health describe conditions, both physical and social, that influence health outcomes. Physical conditions, such as a lack of access to safe housing, clean drinking water, nutritious food, and safe neighborhoods, contribute to poor health. Sociopolitical conditions, such as racism, gender inequality, poverty, lack of access to quality education, and jobs that pay a livable wage, as well as mass incarceration, all ultimately influence individuals' health and the health of communities. Social determinants of health have been shown to affect many conditions related to women's and maternal health, including preterm birth, unintended pregnancy, infertility, cervical cancer, breast cancer, and maternal mortality. As seen in this diagram, good maternal health outcomes, such as full-term births, healthy birth weight, fewer maternal deaths, decreased severe maternal morbidity, and better postpartum depression care, are all affected by things such as structural determinants, like socioeconomic position and race ethnicity, maternal circumstances, such as safe living and working conditions, secure access to food, stable housing, and available transportation, as well as the maternal health system, which should be accessible, affordable, risk-appropriate, high-quality, patient-centered, coordinated, and equitable. It is important as healthcare providers to take a patient-centered approach, always taking into account the possibility of social determinants of health. When this is not taken into account, maternal health outcomes can suffer. For example, a pregnant patient with gestational diabetes who has not checked her blood sugars may be labeled as non-compliant or irresponsible, but upon probing deeper, you may discover that the patient lacks stable housing and forgets her glucometer each time she moves to another family member's or friend's house. Educating the patient about the importance of blood sugar control would not be effective. However, working with case management to address housing issues would be a greater service to enabling her to manage her diabetes. Another example is a pregnant patient with poor weight gain who is evaluated for medical comorbidities. Upon probing deeper, you find that she was fired from her job and cannot afford enough food for herself and her 2 children. Ordering tests or educating her on the importance of good nutrition in pregnancy would not do any good unless it was accompanied by referrals for food assistance. Screening for social determinants of health is a necessity, and there are tools available to assist providers in screening for some conditions, such as food insecurities and housing instability. Providing referrals to housing or food services while patients are in the clinic can improve their healthcare usage. This particular tool comes from ACOG and is an example of a sample screening tool for social determinants of health. In the next 4 vignettes, I will discuss 4 topics that commonly affect pregnancy related to social determinants of health, including postpartum mental health, incarceration, postpartum insurance challenges, and substance abuse services and access.